Erie Vital Signs. Measuring progress, inspiring action.
Hello, I'm Kim Young, and welcome to Vital Signs, Measuring Progress, Inspiring Action. For the next hour, we will talk about the health of our economy, culture, educational success, environment, and our health. Think of this program as a report card on Erie County. All of the data presented comes from Erie's Vital Signs Project, a collaboration of the Erie Community Foundation, the Nonprofit Partnership, United Way of Erie County, the Erie Regional Chamber and Growth Partnership, and Erie Together. Joining me now is President of the Erie Community Foundation, Mike Batchelor. Welcome, Mike.
Thank you, Kim. Happy to be here.
Let's start with explaining exactly what Vital Signs is.
Sure. Erie Vital Signs is a collaborative, community-wide key indicator project. We've created a very user-friendly website that presents lots of data on Erie and compares us to other communities. We're doing this in collaboration with the United Way, the Chamber, and other organizations. The importance here is we're all speaking the same language, we're all looking at the same indicators, and most importantly, we hope this data will provide folks with good information as we try to move our community forward. Bill Jackson, my colleague from United Way, will now explain Erie Vital Signs from his perspective.
We've been in this community for almost 100 years, and during most of that time we've had a pretty basic business plan. You go out and raise as much money as we can every year and then distribute that money as best we can to worthwhile programs and services in the community. And that does accomplish really good things. One of the problems with it, though, is trying to measure the collective impact of all of that. I can tell you about these 50 kids over here that are better off. I can tell you about these 25 seniors or these 100 families. Definitely good outcomes, definitely improving lives. It is our community as a whole better off. And that's really where Vital Signs comes in, because it allows us to see where that needle can be moved. And this fits in very well with the new strategic direction that our board at United Way has announced this year. Because instead of starting with the money and deciding, okay, where should it go to do the most good, we're starting with the issue. And when you look at Vital Signs, at least when we look at Vital Signs, the most pressing issue in our community is the high level of poverty, the number of families that are not self-sufficient, meaning they can't get by without some kind of public or private assistance. So we've decided to challenge our community to take that on as an issue. We've set a goal to improve the lives of 10,000 more families in terms of self-sufficiency by the year 2025. And what's great about Vital Signs is anybody at any time can go look at that and see how we're doing, because we're going to update that kind of information. In addition, we have very specific goals in 3 key areas that are also main topic areas of Vital Signs. We have the education area, we have a financial stability area, which would be part of the economy bucket in Vital Signs, and then of course we have health. When you look in Vital Signs, you'll find that our high school graduation rates aren't that bad when they're compared to our peer communities. But when you look beyond high school, a different picture emerges. Our success rates of our students when they get into higher education do not compare favorably, especially to the best performing peer communities are twice as good as us in terms of those stats. So we need to focus on having our kids, when they graduate from high school, ready to succeed for their next step.
So it seems, Mike, from what Bill has summarized about Vital Signs, that it's really, not to use a cliche, but a vital tool for the community.
Well, that's correct. I think you can see how the United Way is using measurable data in Erie Vital Signs to shape their activities. And I think more importantly, how the entire community can take a look at that and see how we're all doing, not just United Way, but the Community Foundation and other partners. Bill McCarthy and Andy Glass will now discuss the health area of Erie Vital Signs.
Well, my personal background has really been over 40 years in the mental health field. Mental health field has really now encompassed substance abuse as well, and so it really has taken on the new name of behavioral health. And I think that's particularly apropos when we look at health conditions in America. Certainly we look at health conditions in our community, and we look at the specific vital signs. So much of what has to change is people's behavior. So I think that behavioral health has a very, very significant role to play in the overall condition of health care in America. If you look at our community related to health, what we have is an exceptional array of health care. We have marvelous hospitals, we have great providers. The issue is not whether or not we have that kind of resource available to us. The issue is whether people are actually getting better, whether they're getting healthier, and so forth. And the data is fairly clear that if you go back in time, what you'll find is that most people went to their doctors for acute problems. They went for a sore throat, they went for a bad knee, etc. And really, patients didn't need to know much about their health. They would show up at a doctor's office, they'd show up at a hospital, the doctor would give them a prescription, and in 10 days the problem would be gone. Today what we see is chronic problems. We're seeing diabetes, obesity, we're seeing addiction to tobacco, we're seeing all kinds of healthcare conditions that really require the patient to be engaged, to understand his or her symptoms, to be a partner with their physician. And that's where we're really falling down. We do not have people understanding what they need to do, how they need to change their behavior to get healthy. It is no longer acceptable to just rely on what the doctor has to say, because the fact is what you do after you leave the doctor's office is what matters most. And that's the area that we really need to focus on in this community. A big component that is often not included when we talk about health is mental health. And the fact is that really the head is very much connected to the rest of the body. And so much of what really ails Americans today is depression, anxiety. In fact, it's frankly the largest amount of prescriptions in America are written around the issue of anxiety disorders and depression. We have to deal with that as part of the overall health care in America. And clearly it has to be part of how a physician addresses his or her patients when they walk through the door. Clearly education matters here. Teaching patients, first of all, that the fact that they're part of the solution, that their behavior really matters a great deal in terms of the overall outcome. I do think this really has to start at a very young age, though. Tragically, so many of our teenagers are actually the heads of households. They're taking care of little children themselves. So it's a very big task to do, but it's got to start, I think, around patient education.
What we are responsible for is the overall community health that exists in Erie County. And with that, we take a look not necessarily at the specific individual health of individuals, but at the collective health when we look at various parameters throughout the county. For example, when we look at a population, we look at the incidence of heart disease. We look at the incidence of cancer. We look at the incidence of specific cancers. We look at the incidence of diabetes within Erie County. So from the public health standpoint, we're looking at very well-known diseases, disease entities, and health indicators. The indicators that we use within vital signs have been winnowed down or narrowed down from a broad selection that we could have been using. What we look at specifically are indicators that we know we can compare with other communities. We know that we can compare with the nation as a whole. When we look at the data that is provided through vital signs on the overall population, we see that we don't do real well. There are many, many reasons that the health status of a population exists. One of the things that we know that Erie faces as a very specific challenge and becomes a very specific underlying reason that affects the health of Erie County in general is the socioeconomic status of the citizens within our community. That's why programs such as Erie Together, and specifically Erie Together, are so important to Erie, because without good economic health and vitality amongst our individual citizens, while poverty is still affecting so much of our citizenry, it is going to be very, very difficult to attain the health status as a community that we would like to see in Erie County. One of the things that is very distinctive for Erie and Erie County is the fact that we are blessed and very rich with health resources within the community. Through the efforts that we're currently conducting in conjunction with Vital Signs, as well as with the community health assessment, all of the acute care providers, as well as the not-for-profit agencies which are providing health services, we are going to bring together an understanding of the specific factors that are responsible for ill health within the community and agree on a focus so that we can begin to improve health throughout the community.
There's a lot, Mike, I think, packed in there with what both Bill and Andy said. So if you can help us kind of deconstruct what they said a little bit and really narrow the focus.
Sure. I think the health area of vital signs is probably the most robust. Anyone that takes a look at that is going to find a wealth of data. What we hope this will be useful for is not only the practitioners, but the general public. As both Bill and Andy said, the general public needs to take more ownership of their health decisions, and through Erie Vital Signs, I think that is a possibility. I also think many of the practitioners, in terms of nonprofit organizations and healthcare providers, can look at the data in Erie Vital Signs and try to make logical decisions on healthcare delivery or various programs that could be offered.
And ways to address some of the issues
Correct.
that we're seeing.
That's correct, yes.
Yeah. Well, let's talk about the next area of vital signs. Where are we moving ahead?
Sure.
now?
Sure. The next area of Erie Vital Signs, we're going to hear from Sue Brion, who will talk about cultural vitality.
We are extremely fortunate in this region to have a higher level of quality amenities, businesses, and artists than many peer communities, not only across the state, but across the country. But in recent years, there's been a disturbing trend of declining revenues, both on the public and private side, to support and sustain existing opportunities and also to create new ones. Another area of opportunity is that the Erie region has always been a great ethnic center. We have numerous new populations, wonderful immigrants that are bringing in opportunities for us to grow our arts, our culture, and our recreation. We also have the opportunity to really take advantage of a national and regional trend in cultural tourism. We have the amenities to bring people here. We have the ability to give them a good experience and to send them away wanting more. I think that if we would improve our marketing of these kinds of venues and events, we could grow the economy through cultural tourism. Cultural vitality is a tremendous indicator for the Erie region. The amenities, the people, the partnerships and the collaboration we have are some of the best tools in a toolbox to build the economy, particularly on the arts and culture and recreational side. We have good data, not just anecdotal, but actual evidence that shows what our amenities are, how they're growing, and I would encourage people to really pay attention to this vital sign on the website and provide feedback and help us gather the information and watch this area grow over the coming years.
Sue Brion covered a lot in that clip, Mike, and so when we talk about the cultural vitality and health of our region, how do you actually apply some of the data that you're collecting?
Sure. Well, I think Sue did a really wonderful job in setting up the themes that are developing out of Erie Vital Signs. Through this work to create Erie Vital Signs, we've convened nearly 100 people to identify the indicators and then to take a look at them and say, what is it telling us? So in the cultural vitality area, Sue mentioned a couple themes that are developing: cultural tourism and also dealing with new ethnic groups and the opportunities being provided there. So as this work continues, more themes will develop, and we hope that goes a long way towards the inspiring community action piece of Erie Vital Signs. Some of this is about how do we get our community all rowing the boat in the same direction. So next we're going to hear from Alan Kugler to talk about the regionalism piece of Erie Vital Signs.
When we look at the vital signs, we see several indicators there in the area of regionalism. Right now we're looking at a number of governmental entities, number of employees in local government, councils of governments and collaborative activities. The indicators take us in the right direction. There are also other indicators that will, I believe, ultimately be brought to that. And those will deal with a lot of the collaborative activities that are happening in the community. The great benefit of the indicators is that by bringing data to bear, such as that Vital Signs is doing, it creates the opportunity to use that data in policy decision making. When we look at communities such as Erie, we see that there are many, many municipalities. That data shows us that. And we're dealing with those municipalities every day. Now, those governments are within the community, but the community is much broader than those governments. Those governments span multiple municipalities. And it is essential that as we move into the future, that those municipalities, the municipal officials, the staff in those entities, cooperate across their boundaries to work toward a vision of the future and what we want the community to be in the future. And so it's really important that we do the things in the moment that will impact the future, working in partnership across these jurisdictional boundaries, and then bringing to bear the civic and other organizations, such as the Erie Community Foundation or others that are involved in the community, to partner with the governments to help move them toward that vision of the future, and then action to help achieve that. All of these things that the Erie Community Foundation has been doing in the area of governance and regionalism has been a great benefit toward that end. Actually, Erie is pretty much in the forefront of cooperative activities for one reason or another. We've been here doing it now for since 1998 that I have not, no, since 1988 that I've been involved in, and so we have a lot of experience at it. And we have a knowable community. This is not so large that we can't handle it and deal with all the players in the community. We must assist the governments through intergovernmental organizations in partnership with civic and business community players to bring resources to bear to act together across these boundaries so that we can grow this community.
Mike Allen Kugler talks about regionalism, and that is a really tough issue. It's a point of contention in this region.
Sure is. Many interesting discussions around regionalism for decades in Erie County, and Allen and his group certainly are recognized as experts on the topic statewide. So through Erie Vital Signs and the data on regionalism, we're trying to encourage a more broad-based public dialogue on the topic. How that moves forward is not in our control, and we need broad-based citizenry input into this and lots of people to review and weigh in. So the next topic area is one that's very critical to our community: education, education, education.
In 2011, in some of our local communities, 20 to 25% of third graders were unable to read. Additionally, only 67% of Erie County youth plan to go to some post-secondary education versus 73% in the rest of Pennsylvania. And the percentage of Erie youth that are continuing their education beyond high school has declined over the last year. I am project facilitator for Erie Together, which is the region's anti-poverty initiative. And Erie Together is not a social service program, but rather it's a civic movement that brings people from all different backgrounds, both personal and professional, together to look at poverty from a number of different ways and determine how to best make this a community of opportunity where everyone can learn, work, and thrive. So Erie Together is attacking poverty through 3 different vantage points: with families directly, in neighborhoods, and through 4 countywide action teams. Much of Erie Together's work is focused on the educational arena, and essentially all of our work is designed to help move the needle on the things that Vital Signs are trying to measure. I think we can really move the indicators in this respect if we focus and devote our resources on early childhood education, making sure that kids are prepared to enter kindergarten and that they have the resources that they need to be successful in their early elementary school years. Secondly, I think we can really make an impact if we as a community commit to providing quality career exploration opportunities for children at all ages, so they understand what their opportunities are when they graduate from high school, they know what kind of education they need and the classes they need to take in high school and how well they need to perform, and that they also know what kind of education or training they should pursue after high school. Finally, research has shown that there's a direct correlation between educational attainment and earning potential. Our community needs to understand this and place value in education, because that's the way that individuals and families will come out of poverty. Taking it one step further, I think it's important for all of us to recognize that In order for our economy to be as strong as it can be, we need to have the workforce that has the skills and strong educational foundation that they need to fill the needs of the local business community.
Education is absolutely critical. We need to start early, and I'm particularly concerned about having all of the children in Erie County have the best educational start in life. And that includes having a high-quality early childhood experience. We know that studies have shown that children who start education early are likelier to be successful, graduate from high school, fewer delinquency rates, and it all starts at the early childhood level. Each year, Pennsylvania looks at each of the counties across the state of Pennsylvania. And Erie County has consistently come in as having one of the largest numbers of children at risk for failure. Obviously, we're setting ourselves up for long-term failure if we're not getting to the children at a younger and younger age. I think there's several things we need to do to make it better for children at this young age. First of all, we need to have a change of culture in our community at large. We need to value education and to recognize that it does start early. We also need to recognize in our community the importance of the role of parents and caregivers. We have an increasing number of grandparents who are raising their grandchildren, as well as other family arrangements. We need to provide support to them and education. Through the Erie Together initiative, which is fabulous in Erie County, a kindergarten checklist was developed, and that's being distributed broadly. This is a guide for parents to understand what is appropriate in terms of child development before children enter kindergarten. It helps guide them as to what will help to make their children ready to succeed. And as professionals in early childhood, we need to work with parents so they understand how to achieve some of those outcomes. There's a couple of things that can be done specifically within Erie County. An initiative that was begun after 2 years of planning is called Erie's Future Fund, and through a wonderful collaboration of the Erie Community Foundation, United Way of Erie County, and several business leaders, this year for the first time, there's going to be almost 300 children who have had no early childhood experience before going to a high-quality early childhood center.
We monitor a survey instrument called the Pennsylvania Youth Survey, and we work really close with the Mercyhurst University Civic Institute, who administers the survey. And the survey gives us a lot of data on 4 domains: community, school, family, and individual and peer. So in the school domain, we can assess risk and protective factors for students beginning in 6th grade, where we can tell whether or not they're heading down a path to be a school dropout or other problem behaviors before they happen. And we think those future predictors are actually more important than just the prevalence rates that we find. It's very easy to tell you what the dropout rate is, or what the teen pregnancy rate is, or how many % of students had a weapon on school property. But what's harder for people to comprehend is truancy, for example, school dropout. It's a very complex issue. It's just not students not going to school. It's more about what are the social conditions that exist in their lives, in their homes, and in their families that cause them to not go to school. For example, academic failure in 4th grade is a leading predictor of school dropout. So academic failure relates to truancy. So there's probably about 19 risk factors in a student's life that the more of these risk factors they have, the worse they're going to do. So the kind of predictors that we're looking at is academic failure, what % of students are bonded to their school environment, and so on. I think what we have found out working across the state and around the country is that using an approach like the Erie Vital Signs, using a data-driven, focused approach, is better than just applying programs and where we think we need to put them. We let the data do the talking. We actually follow the data to implement which programs will be most effective. We're actually using a framework for prevention called the 40 Developmental Assets, and what we have found out is we can implement programs in schools to reverse school truancy and dropout and things like that. But we have found through the Search Institute, which is a national organization on prevention research, that relationships between teachers and students and their community is actually more vital than just implementing programs. So we're working on a larger climate of a positive school climate, and students getting along better with their teachers, bonding to their community, is actually more important than just implementing programs.
When we talk about education, it seems to be the most vital component. You certainly have some data that shows that correlation between success and education.
Sure. It's a complicated topic, but here's the bottom line. Education correlates very closely to wealth and income over time. Erie County educational attainment rates are well below Pennsylvania. Pennsylvania is well below the nation, and the nation, unfortunately, is below the world. So we need to have some sincere and serious talks about how to change our culture here in Erie County and perhaps our delivery system so that more of our kids are prepared for school, more of our kids go to school, get a great education, and hopefully we're able to retain more of our kids to build their life and their career here in Erie County.
Another important aspect of vital signs is how we tend to our environment.
I work for the Erie County Conservation District Office, which is Erie County's local conservation and environmental department. We work closely with other agencies in Erie County, such as County Planning and the Department of Health, but we more or less represent Erie County on an environmental and conservation level. With vital signs, we're looking for some new benchmarks to follow, but the ones we're currently following are housing density and population density, and both of those for Erie County are increasing. When it comes to an increase in population density or housing density, it's not necessarily a bad thing, but it is something that we have to watch. And when you have development like that, whether it is redevelopment of existing areas or development of new areas, you need to make sure that you're developing those areas responsibly. And it's one of the areas where the Conservation District steps in, and that is one of the main things that we can keep an eye on when it comes to vital signs, because monitoring development in agricultural areas or in existing areas in terms of redevelopment are a good way for us to safeguard our natural resources for the county. Everyone, I think, is on some level aware of natural resources as something that is important to them. But in Erie, we have a couple really unique perspectives, three of which being obviously Presque Isle in Lake Erie. And a lot of people don't realize that we also have a lot of the headwaters of the Ohio River Basin here. So what happens in Erie County affects not only the Lake Erie watershed, but also the Ohio River watershed. So you're looking at things in Erie County happening both on the St. Lawrence Seaway as well as the Mississippi River. So we have all of those things happening in Erie County that reach on a very, very wide scale. So it's easy for us to kind of turn our backs on the lake or Presque Isle because they're very local things. But both of those, right from the onset, are a huge economic and competitive advantage for Erie County. And so it's important for us to recognize those and other natural resources in the area as giving Erie an edge over areas that don't have the tourist resources or the freshwater resources and things like that. One of the things that we try and instill in people is a change in perspective. We don't actually change anything around us. It's what's inside of us that has to change in terms of recognizing the importance of those natural resources. So the Conservation District has educational outreach and works with developers for responsible building development and agricultural resources around the area for responsible farm development.
In Joe's discussion of the environment, I think it really highlights the point that we tend to overlook this as one of the vital signs, our environment.
I think that's fair to say. Erie County, we tend to, because we have a beautiful lake, we tend to think things are fine in the environmental area. But it does merit attention, as was mentioned during Erie Vital Signs. The environment is also an economic driver. You think about tourism, and you also think about, when we talked about education, how to get more people back into our community, our young people. They certainly want to come here and they want to live in a place that is environmentally friendly. We're now going to talk about economic self-sufficiency through Erie Vital Signs.
The economy is an essential part of addressing so many of the issues that are measured in vital signs. The basic premise is if individuals are employed and earning dollars, they are going to be able to contribute to the community in very positive ways. If they're unemployed and not earning dollars, there's a tendency for them to migrate to behaviors that aren't productive for the community, and in some cases, in fact, could be detrimental to the community. So the economy is vitally important for us as a region to move forward. We need people working, we need people increasing their skill sets, and we need people increasing their earning power. And with that will come so many positive things. We're tracking a number of variables, and we continue to look at others that will give us a very clear and robust picture of what's happening in the Erie market. The obvious one is unemployment. We will continue to monitor the unemployment rate, but we really will be looking very deeply at the total number of people employed in Erie County. You can, in fact, have your unemployment rate go down by employing the same number of people, but having folks, frankly, stop looking for work. I think one of the hardest things for a community to get their arms around is that an economy is, in fact, a living creature. It contracts and it expands. It has moments of tremendous growth, and it has moments in which arms of it may wither and die. And you need to understand that, because it means that at no point can we take our eyes off of it. That in order for the economy to continue to grow, we need vital components to continue to happen. We need people to continue to be educated. We need companies to make technological advances that help them remain relative in the marketplace and competitive in the marketplace. We need folks to understand how the interplay of spending dollars locally versus outside the community can have a tremendous impact. So the economy will continue to play a critical role in so many of the social aspects of our region that we're measuring through vital signs. More people working, more people earning more money is going to lead to a much more vibrant community, a safer community, and competitive community.
Generally speaking, the concept of self-sufficiency is really a deeply ingrained American value. We raise our children to be self-reliant, to be independent. We teach them how to use their own talents and resources to carve out a place in this world for themselves. Back in the mid-1990s, a university professor and researcher from the state of Washington developed what is called the self-sufficiency standard. It defines self-sufficiency as the ability to provide for your basic needs without relying on any kind of outside supports. No public supports, no private supports. It measures the amount of income that a family of a particular composition in a specific geographic location needs to meet their basic needs. When I say basic needs, I'm not talking a lean budget. I'm really talking about a bare bones budget, a survival budget. And the self-sufficiency standard allows us to look at individual counties in states that have adopted this standard to determine what a livable wage is, to determine what a self-sufficiency wage really is. And what we know about self-sufficiency in Erie County currently through the calculations of the standard is that 24% of households in Erie County live below the self-sufficiency standard. The self-sufficiency wage that you need to earn at an hourly rate is $8.21 to just meet your basic needs. When you consider what the minimum wage is in Pennsylvania, that is $7.25. That's 88% of a self-sufficiency wage for one individual. Being a worker who is receiving minimum wage does not allow that worker to support himself without relying on some other kind of external financial help. I think some of the economic challenges are the result of our manufacturing base eroding over the decades. Our largest employers tend to be in the recreation sector and healthcare sector. With healthcare, there certainly are some high-wage jobs available. In recreation, there certainly are some. To what extent they provide self-sufficiency wages, I don't have that information, but some of it does. Some of the reason why we have this level of poverty, again, as I said, is the nature of the jobs that are available, and being able to match skill sets with jobs available, and being able to create new job training and new career paths for people in the community. These are all areas that need to be assessed. To address poverty, we either have to reduce costs or raise wages. And education is definitely one of those areas that needs to be addressed.
Mike, as Jake said, the economy is so married to all of the other areas of vital signs, but it is also an area we can compare ourselves and get some substantive data.
That's true. And again, we want the general public and community leaders, however they're defined, to really take a close look at this area. The economy area of Erie Vital Signs is just filled with data that compares ourselves to other communities. You can push a button and our ratings go up and down on various charts comparing us to other similarly sized communities. So it's a great tool, and we really hope that folks take advantage of it to help measure progress and inspire action.
The next area of vital signs, what are we looking at when we look at the next area?
Sure. The next area is community and civic engagement, and Bob Wooler, director of the Nonprofit Partnership, will be giving his perspective.
We are involved with a lot of nonprofits in their community engagement mission. So we've spent a lot of years looking at how nonprofits are engaging with the community, how information is traveling around the community that informs how everybody relates to each other, how everybody connects and relates toward building a better community. So from that perspective, I think we have developed some expertise in the whole area of community engagement. Erie Vital Signs is tracking a few different areas as far as community and civic engagement goes. The whole idea of getting folks connected with each other, volunteering for community events, being civically active in terms of voting and following public causes, those are the kinds of things that we think make for a healthy community. So those are the kinds of things that we've found some indicators on vital signs to track over time. And there's some very interesting findings in the social capital area. Just in terms of general trust amongst people in the community, general involvement in community affairs, general participation in nonprofit-led activities, very high, especially when we look at how it relates to the benchmark cities, our peer cities across the country that we're tracking, very high rates in Erie. We have all the raw materials and we have some basic strengths and social capital to really build on. So I think that's a huge area of strength that Erie Vital Signs is looking at, and it's something we can really be proud of and count as an asset going forward. The Nonprofit Partnership and the United Way are working together to develop a volunteer action portal, an online portal that'll match everybody's interests in volunteering with the volunteer opportunities that are available at the many nonprofits that we have. So given the fact that we have relationships with about 300 different nonprofits, we think that'll drive volunteerism in a very healthy direction.
You know, Mike, when we listen to Bob talk about community and civic engagement, I think many people hear community engagement, but maybe turn a deaf ear to that civic engagement. Let's talk about that.
Yeah, that's really true. We have data that shows that Erie has a high level of what's called social capital. People know each other, they like each other, they convene around bowling alleys and bars and churches and what have you. But our level of civic engagement is actually a little low. And what we mean by that is, signing petitions, voting, running for office, dialogue with elected officials. So that's an area, if you look at vital signs and study it and compare us with other communities, you'll find we're a bit lacking there. So our last vital signs discussion area is brain gain, and Donna Douglas will be giving us her perspective.
Well, I am affiliated with an incubator, a business incubator in Edinburgh, Pennsylvania called the Startup Incubator, and we work with creative individuals who are trying to start businesses. And so I'm all about helping entrepreneurs get a foothold in the local economy, and we want to try to keep them here in Erie. We have received a number of grants, and the stipulation with all of those is to help grow the Erie economy. The brain gain and brain drain piece of the vital signs is what interests me the most, and it's because we have 4 universities and a lot of other technical schools here. A lot of young people, and even people who've gone back from the workforce into a new field, oftentimes think they have to leave Erie in order to use the new education that they've received. And in fact, there's a lot of opportunity because Erie has a lower cost of living, and a lot of them think, well, I have to go to New York or California to make a living. But with the way things are in technology today, there's no reason for that. They can stay right here and send all of their work that they do through the internet. Well, I've lived in Erie for about probably 35 years. And I know that it's a pretty stable town and fairly stable, kind of static economy or milieu overall. But I think it's time to really start encouraging everybody, I don't care what age, to be more creative in their thinking and entrepreneurial and consider starting new businesses. They say that most of the new jobs or actual new positions that are created come out of brand new businesses, not companies that have been here for 50 years. So they're great, and they've been very generous to the community in many ways. But I think in order to grow the wealth in the community, we need to really encourage new businesses. One of the things about Erie that's great is we have such a great geography right here on the lake, and that provides a lot of diverse opportunity for recreation as well as economic types of industries, et cetera, new businesses. And the other thing is that it has identified that we do need to encourage younger businesses to get started. We just haven't put our effort towards those kinds of initiatives, and it's starting to happen. In fact, there's something coming up in November where a consortium of organizations are going to host some activities for Global Entrepreneurship Week. So Erie's starting to move in that direction, thanks to Vital Signs.
Mike, my colleague at Penn State Barron, Dr. Jim Curry, has certainly done a lot of research into brain gain, brain drain. And when we talk about this as a vital signs component, what are you finding as we compare ourselves to other communities?
Sure. Erie Vital Signs actually helped sponsor that conference with Dr. Curry, and that's an example of how we're trying to take what few resources we have and sort of guide the public dialogue. So Dr. Curry did a great job in analyzing it, and we convened 80 to 100 people to hear what he said, to learn what he said, show what his studies produced. There is some more dialogue that's happening, and this is an area where there's actually experts that can look at different communities, and we can find places that are doing a better job at bringing, you know, the brain gain talent, the young folks, back to their community and developing an economy around that. So again, complicated issue, but if we don't get it into the public dialogue, nothing will happen. So we believe that Erie Vital Signs has played a role in that.
Well, we certainly have learned a lot over the last hour about the vital signs of Erie County. What now? What do you hope at the Erie Community Foundation, Mike Batchelor, that people who've watched this tonight get from this and do with this?
Sure. Well, I guess the first point I would make is this is unprecedented. In my career, I have never seen major civic leadership organizations banding together around the similar data, looking at the same data, and talking the same language. So that in itself, we hope, will really help move our community forward. The second point is we need dialogue and input from not just people like me and people that run organizations, but from the general community. That's why this is a very public website. We're promoting it as much as we can, and we want everyone to really take a look at www.erievitalsigns.org. Learn about how we compare to other communities. Take a look at the data. Take a look at some of the emerging themes that are developing. Now, these themes are already being used. The Community Foundation is changing some of its grant making based on the work of Erie Vital Signs. You heard from the United Way that they're using Erie Vital Signs as they make their allocations decisions going forward. So the more data we have, I think the better off we'll be as a community. I know our chamber is also convening its CEO leadership group around vital signs topic areas. So we want to get their brain power and knowledge and resources engaged in this process. The third point I'd like to make is this is a long-term project. The challenges facing Erie didn't happen overnight and will not be solved overnight. When we announced Erie Vital Signs, we said it was a decade-long project. Hopefully we'll go on longer than that. Having said that, the data on the website is constantly updated and it's refreshed. We have the ability, as new data is available from public sources, that it's automatically uploaded on Erie Vital Signs. We're also convening elected officials, explaining to them about some of the Erie Vital Signs trends and themes, and educating them on what we're hearing from the general population through Erie Vital Signs. So in summary, the big goal of Erie Vital Signs is to work with others to measure community progress and to inspire positive community action.
Mike Batchelor, President of the Erie Community Foundation, thank you so much, and thank you for joining us.